everyone. My name is Patrick, and I will serve as your moderator today. Welcome to today's webinar, Patient Portals and Blue Button, Make Your Mark and Meet Meaningful Use, brought to you by HIMSS and Iatric Systems. For those of you not familiar with Iatric Systems, for more than 21 years, Iatric Systems has enabled hospitals to share pertinent medical data with patients, healthcare providers, and communities. Adding Blue Button capabilities to their patient portal furthers their mission of using technology to enhance the delivery of healthcare and patient health. So that things run smoothly today, I'd like to cover a few items before we get started. If you have a question, you may use the Q&A function on the right hand of your screen, and you may submit a question at any time during today's webinar. We'll be monitoring these questions throughout the webinar and answer as many as possible during the designated Q&A section at the end of this presentation. Please be sure that you've submitted all of your questions in the Q&A screen, as questions submitted in the chat area may be missed. And finally, a full archive of this presentation will be available at a later date. There will also be an exit survey at the end of today's presentation. Please complete the survey for a chance to win a Kindle Fire. The winner will be notified by January 20th. For technical assistance during today's presentation, send me a private message by selecting Host in your chat area. If you're having trouble with audio today, please let me know immediately to assist you with your options. And now I'd like to introduce today's presenters. Kim Navy is a management analyst in the Veterans and Consumers Health Informatics Office for the Department of Veterans Affairs. James Spiros is a special assistant to the Chief Technology Officer for the Department of Veterans Affairs. Dr. Joshua Seidman is the Director of Meaningful Use at the Office of the National Coordinator for Health Information Technology within the U.S. Department of Health and Human Services. And Michelle Snyder is the Senior Manager for Clinical Product Development at Iatric Systems. Thanks to our presenters for joining us today. And with that, I'd like to pass things over to Kim Navy, who will begin our presentation.
Well, great. Thank you. This is Kim Nazi, and I'm so happy that we are having this chance to share information with you. We'll get started right away since we have a great panel for you today. I'd like to kick off the discussion today by reflecting for a moment about what we know about personal health records and patient portals, and also what we're learning. Having been involved in this for more than a decade, I think we've noted a number of consumer surveys that demonstrate that consumer interest in personal health records has been high, but we've also seen adoption of personal health records has been relatively low, although that's growing. I think the most recent survey that I saw showed that about 10% of American adults are currently using a personal health record. So I think this paradox of high interest and low adoption gives us direction to really think about what consumers value. What we know about consumers, including veterans at the Department of Veterans Affairs that we service, is that consumers really value transactional services to accomplish tasks. They want to be able to refill prescriptions, to be able to access their data. And what we also know is that they're increasingly hungry for additional data. So with the patient portal, My Healthy Vet, that we've had in place since 2003, we continue to increase the numbers of data extracts that are available to My Healthy Vet users from the VA electronic health record directly into their personal health record. We also know, based on a decade, that healthcare has lagged behind other industries in really leveraging the technology that's available to support the delivery of healthcare. One exciting potential is that meaningful use is here, and we really see that crucial in a couple of ways. We see it both as an outcome, so that we know that we not just want to implement technology, but also implement it in ways that enable consumers to use it in meaningful ways. But we also see it as a tool to help us get there. So as we developed our patient portal and continue to expand the functionality, we kind of think about the spirit of meaningful use and use that as a guide to implement principles that help consumers to use the technology in meaningful ways. So based on what we've known for this last decade, I think it's true, and you'll agree with me, that increasing consumer access to data is really a game changer and one that has really promising potential. what we're learning based on our experience with the My Healthy Vet personal health record portal and more recently the Blue Button is that consumer empowerment is critically important, but maybe there's been a missing piece. As healthcare organizations offering delivery of healthcare services to patients, we want more than to just empower consumers independently. We also want to be able to have them meet a receptive healthcare time and really integrate use of these tools within the care settings. We also are learning from a number of recent studies that clinician endorsement of technology use in personal health records is going to be really crucial to be transforming the outcomes that patients can have with these tools. We know that clinicians value solutions that integrate with their clinical workflow. They want to have technology that engages and activates patients, and they also want easy access to their patients' personal health information. For VA, for example, we know that there's a significant number of veterans who are co-managed, and that means that they not only get care within VA, but also from physicians in the community. So that really places focus on the need to provide patients with tools through which they can access and share, if they choose, their personal health information. So increasing consumer access to data is really still a game changer. I want to tell you a little bit about the genesis of the new kid on the block, the Blue Button. And the Blue Button was really an idea that was born in January of 2010 in New York City at a meeting of the Markle Foundation Consumer Engagement Work Group. The group had gotten together to talk about some of the great things that were going on in terms of implementing electronic health records and things, but the group really also wanted to focus on what meaning that has for consumers, thinking together about how to kind of create an on-ramp to all that data so that consumers could also be empowered and play an important role in managing their health care. The idea that came up in that meeting was a place to start would be that these large healthcare organizations that provide healthcare services and are homes for this rich pool of data could add a button to their portals and enable consumers to have access to their data. So as the discussion continued, the idea of a blue button, adding a button to these portals as a starting place to enhance meaningful use, really kind of got very excited, and as a result of that, 3 federal agencies really kind of ran with that idea. The Department of Veterans Affairs, the Centers for Medicare and Medicaid Services, and the Department of Defense collaborated to begin to quickly look at how to integrate a blue button into our beneficiary portals. The focus really was on providing simple access to consumers to their personal health information, and doing so in a way that would enable them to generate and download a human-readable, parsable copy of their electronic health data. We were very focused on doing this because we knew that providing consumers with easy access to their data had a lot of promising potential for some very positive outcomes. We knew that it would improve the quality of healthcare delivery for veterans and the beneficiaries of these portals. And rather than kind of wait and take time until emerging standards were in place and everything, was available in the portal, we agreed to start immediately to be able to, as a first place, offer veterans access to the data that was already available to them within the My Healthy Vet personal health record portal. Another goal was also to really empower consumers and to in the spirit of meaningful use, provide them with easy access to their data in ways that could be actionable. So in addition to providing access to the data to veterans and consumers, we also knew that making these data sets available would incentivize industry and the marketplace to address the issues with being able to utilize the technology and make simple solutions available that would make that data actionable for consumers. So in addition to providing access to the data, also incentivizing industry to create solutions that consumers could then use to use that data in meaningful ways. In the spirit of open government, throughout this process, with those intents, we posted sample data sets, and each time we had an incremental release of new data within our product, we updated those sample files so that with the transparent sharing of that information, we worked with industry partners to really design some pretty innovative solutions, some amazing things that our industry partners have been able to do with that data to support consumer use. And above all, we really wanted to improve veteran satisfaction, improve health outcomes, knowing that we started simply but had some pretty ambitious plans to see this as an evolution. So with the Blue Button, our initial offering in August of 2010 made a combination of both self-entered data and data from the VA electronic health record available to veterans. We did so in a very simple format, and as we did so, we worked quite closely with our federal agency partners and did so in a way to try to make this consistent across agencies so that it would benefit consumers. We also had the great advantage of having Markle Foundation's policies and practice, and we took those as an opportunity to really operationalize meaningful use by doing things like building those principles into the interface and making content available through the portal so that not only would we present the information, but we would also help consumers to understand how to protect their personal health information. Our vision was also to quickly expand the kinds of data that was available through the VA Blue Button. And since that time, we've actually added several extracts of data from the VA electronic health record. So today, veterans can utilize the Blue Button on the My Healthy Vet portal and quickly generate an electronic copy of their personal health information. And if they're authenticated, that information also includes some very important data from the VA electronic health record. We also knew that being able to systematize the ways that veterans could share that information will be important. So our vision is really to continue on this evolutionary pathway and to provide options for veterans that are interoperable with additional file formats and standardization of that data so that we can integrate within that new ways for veterans to also be able to share their data in ways that continue to protect the security and the privacy of their information. So I'd like to just say a word about our My Healthy Vet personal health record portal. We launched that portal after a very successful pilot back in 2003. We've had some great response from veterans through the pilot. They can actually, through the national portal, renew their prescriptions and do a variety of different things, including also self-entering and managing their personal health information. Since November of 2011, we've had more than 59 million visits to the portal, and we currently support over 1.5 million registered users. So you can see that we have pretty high acceptance of that, and we also have some great satisfaction. Integrated within the My Healthy Vet personal health record is the VA Blue Button. So it's very easy for veterans to log on to My Healthy Vet and utilize the Blue Button. Today, we have a number of data classes that are available for download using this mechanism. And as you can see from this slide, it's really a combination of self-entered data that veterans enter within the portal, as well as some pretty important data classes coming to the portal from the VA electronic health record. This past December, we actually added a new data class so that drawing upon where data is stored within the Department of Defense, we were able to integrate information about military service within the Blue Button so that veterans can have easy access to some of the historical data about their military service and use a variety of different tools to translate that into skills to support their employment efforts. Lastly, I'd like to just give you a flavor of how the Blue Button works by taking you through a couple of screenshots, and then I'll conclude by showing you a few statistics of use. You can see that the VA Blue Button is prominent on the home page of our portal, where veterans are invited to download their data. Some early feedback that we got from veteran users was that they wanted to be able to customize their download. So in January 2011, we added the ability to customize the download, and veterans can choose to download all of their available data, or they can choose to create a customized download by inputting information about the data classes that they'd like to include and or the date range for that data that they'd like to include. So you can imagine a veteran preparing for a clinic visit and creating a customized download focused on a specific need. Once they've made their selections, they're presented with their download results. And the other early feedback that we got was that they wanted to be able to download their data in different file formats. Today, veterans can download their data in that plain text file that we started with. However, they can also download an enhanced PDF file format, which presents the information in a way that's easy to understand and to be able to print for sharing with others. And here's a look at comparison for that plain text file format as well as the enhanced PDF version of that very same information. We've had a great response from veterans utilizing the VA Blue Button. As you can see, we continue to have growth both in new users and also users returning to the portal to utilize the Blue Button again. We've also had some interesting data related to the file formats and an increasing activity in that area. And what we've noticed is that PDF is a very popular file format, as well as the plain text file and a new custom file format that we've offered, which is a Blue Button file format. We also have a lot of interest in evaluation of the Blue Button, so we continue to collect and analyze statistics of use. We're excited to share that since the Blue Button was launched in August of 2010, we've had over 376,000 unique registered users utilize the Blue Button to download their data. And those users have actually downloaded more than 900,000 files using this mechanism. And they can also choose to view that output in their browser, and as you can see, many choose to do that as well. When we utilize some of our evaluation tools to ask veterans about their degree of satisfaction with the product, we learned that VA medication history is one of the most useful parts of the Blue Button, and that's not surprising to us because we know that veterans find it very easy to have a copy of their medication history, including their VA prescription history, and we know that they also find that to be very useful as they seek care in the community. When we ask for feedback about the Blue Button, I think it's clear that veterans want us to continue to increase the kinds of data that's available to them via this mechanism, in addition to wanting to be able to customize their download. And as you can see, we've got some great feedback from veterans about the usefulness of this, and we will continue to expand the kinds of data that are available, as well as move towards that evolved vision of being able to make it easy for veterans to share their information throughout that. Next, to tell you a little bit more about the evolution of the Blue Button and what's happening now, I'd like to introduce my colleague, Jim Spiros, from the Chief Technology Officer's office. Jim?
Hey, Kim, thank you so very much, and fantastic presentation. Folks, Kim has done her usual superb job of showing how a simple idea has become a rich and a really sophisticated product. And I have to tell you, the My Healthy Vet Blue Button has been an astoundingly successful way of improving how VA relates to our veterans and how our veterans relate to us. Which leads me to the theme for the next few minutes. And that is, from a technical perspective, Blue Button is great. And as it builds momentum, we're seeing a fantastic number of new technical applications coming online. But what's probably more important for a non-techie like me is how Blue Button is transforming the relationships between consumers and the institutions and professionals with whom they do business. This is because Blue Button has been a catalyst for creating consumer expectations that consumers will access their data as a routine part of how they do business. And we're seeing the beginning of Blue Button as a market differentiator, something consumers use to choose one vendor over another. And Patrick, if you could move to the next slide, please. Did I mention that there's some momentum building? As Kim has mentioned, we thought Blue Button would be pretty cool as an electronic clipboard, something you could use to take your medical information to a new doctor, or maybe to a doctor you haven't seen in a while. There's perhaps a dozen vendors out there right now, today, who are selling thumb drives and other ways of doing just that. But what we're finding is that folks are also discovering other ways of using their own data, and they're doing it entirely without our help. A lot of the activity is in mobile applications. VA, we're going national this year with a mobile app we piloted in 2011. Northrop Grumman, one of the pioneers in Blue Button adoption, Northrop launched a mobile Blue Button app last year, which I've got on my iPhone. Other developers are building mobile apps that will work on your Android as well as your iPhone, and other developers have apps that have been upscaled to work on tablets as well. But these apps aren't just carrying data. They're consolidating it, they're graphing it, they're making sense of it. They're helping people make decisions about their diets, their exercise, their medications, and how they can choose to be more healthy and take action so that they can be more healthy. But that's high-tech. Let's not forget the low-tech uses of Blue Button either. My daughter-in-law told me last August that she downloaded our grandson's immunization records and carried them with her when she registered him at school. We know that many patients with complex or chronic conditions will keep a Blue Button printout in an envelope they stick to the refrigerator, just in case they have to go to the doctor fast or someone has to call the paramedics. Paper, it might be low-tech, but hey, it works. And if we can move to the next slide, please. So what kinds of data is the Blue Button moving these days? Kim has shown how Blue Button lets you download a broad range of clinical data that comes directly from the care you receive. And when you're a health plan like VA that delivers care directly to patients, you have those data in your databases. But people are interested in more than just clinical data. They care about what it costs. Many health plans don't deliver care. They pay claims. The biggest of these health plans, of course, is Medicare. And if you're a Medicare beneficiary, or if your parents are Medicare beneficiaries, you can download claims data using the Blue Button right there on Medicare's website, and the citations there on the slide. Other health plans, and these are big ones, are using Blue Button to enhance their relationships with their customers too. Aetna, they went live in September with the Blue Button function in their patient portal. United Healthcare, they're going to be doing the so before the snow stops flying. And the rest of the healthcare industry will be joining us as well. Just before the holidays, the U.S. Office of Personnel Management, they're the folks who administer health insurance for all federal employees, including members of Congress. OPM announced that all federal health plans would have a Blue Button on their patient portals. This means that by the end of this year, if they don't already, all the major and most of the smaller health insurers will have a Blue Button on their websites. And I've got to say this too, Blue Button's doing more than just moving data from provider to patient and back again. Some of the more intriguing apps we've seen are using the Blue Button ASCII format, the text format, to move data via NHIN Direct. And we know of at least one major health plan which is using the Blue Button text format to move data from provider to provider within its own network. Again, folks are figuring out ways of using Blue Button data entirely without our help, and it's fascinating to watch and see happen. Next slide, if I could, Patrick. Finally, and I know my time is short, I want to mention this. We're seeing this simple idea, giving people access to their data. This simple idea is happening in other spaces as well. If you live in Southern California, sometime this week or maybe next, you're going to see the launch of the Green Button. This will allow you to download your energy data from your electric utility. What's interesting is that our colleagues at the Department of Energy and the pioneering utilities who are launching the Green Button chose to take the Blue Button logo and just color it green. What that choice says is that this logo, the Download My Data logo, is becoming recognized as what people look for when they want their data. Another example, the Purple Button, a collaboration between our colleagues in the Department of Education and high school and higher education groups. By the end of the year, they'll be launching ways in which you can get all kinds of your education data online, simply, easily, and securely. Point of all this is this, folks. Blue Button is a lot more than just getting health data to patients. It's about building stronger relationships between consumers and the professionals and the businesses with which they do business. It's about making download my data a standard part of how business is done. Hope these comments have been helpful. At this point, I'd like to turn the microphone over to my colleague at the National Coordinator's Office, Dr. Josh Sedman.
Hi, thanks very much. I think this is really exciting what's going on at the VA. They really have been leaders in making data available in ways that their veterans can use it. What I was going to do is put it into a little bit of context of what's going on with the Meaningful Use program and explain specifically how it fits into our broader quality agenda. So in March of 2011, the Department of Health and Human Services released a national quality strategy. The three aims, part of the triple aim or three-part aim, better care, affordable care, healthy people, and a set of 6 priorities. And these priorities for the department really are the lens through which all quality planning are made, quality planning decisions are made. And so making care safer by reducing harm, making quality more affordable for everybody, promoting effective communication and coordination of care, working with communities to promote wide use of best practices, promoting the most effective prevention and treatment practices, and then finally, ensuring that each person and family are engaged as partners in their care. And clearly the Blue Button approach is something that fits in very much with these, especially around promoting effective care coordination and communication and around the goals around engaging patients and families as partners. So what I'm going to do is just quickly walk through how the National Quality Strategy plays out with respect to 4 of those priorities. I'm going to quickly go through the first couple and then spend a little more time on the last 2 that are more relevant to the Blue Button. So first, the idea here is that there are certain types of data that one needs in order to accomplish this priority of reducing cardiovascular morbidity and mortality. You need certain types of data inputs like demographics, blood pressure, smoking, etc. And you need certain basic care processes, the ability to electronically report clinical quality measures, clinical decision support systems, and registries to proactively reach out to people. To ensure safer care, you then add a few other things. So in addition to the things that we had before, we would add allergy and lab data. We'd add a few additional clinical processes as well. Computerized physician order entry, drug and drug allergy interaction checking, and electronic prescribing. And then here in the blue, you'll see these are recommendations for the Health IT Policy Committee for Stage 2. I can't talk specifically about what is going to be proposed in the Notice of Proposed Rulemaking that will be coming out from the department sometime next month, but these are recommendations from the policy committee that are seriously being considered, and you'll see that in the next slide as well. So you can see then you think about adding in some additional things. So you think about patient education resources that are EHR enabled. Think about some additional care processes, after visit summaries, patient reminders, and then allowing patient access and patient copy. And this is where the recommendations from the policy committee recognize the importance of moving from that paradigm of copy and access to a paradigm of view and download, really building on the work of the VA, the DoD, the Markle Foundation, and others in thinking about how to make sure that data gets to patients and families in ways that are useful for them. And then, finally, improving care coordination. And again, adding some additional things, but again, thinking about how to move from just a shared care summary to something that is a shared care plan that can be used across delivery settings. And again, the ability to have a standardized tool that can be downloaded and shared is really important. What I wanted to do next is to walk through how this plays out, how this can actually be used in the real world. So that objective in the patient-family engagement domain of meaningful use around EHR-enabled patient-specific education resources. There are many ways that this can be done. There are actually several vendors out there that have specific products. This is something that the National Library of Medicine has made available open source to anybody who wants to use it, which is basically a way to connect the content that exists in Medline Plus, which is the consumer-facing side of the National Library of Medicine's content library, to connect it to specific codes. And they now have, actually in addition to problem codes and medication codes, they also have laboratory codes. And so each of those codes connects to specific URL, specific content within Medline Plus through a mapping, and that then generates specific content for them to use. These are the ways that they get the codes, and the idea here is that someone would have a specific code, and that specific code directs a patient to specific content that meets their needs. Now, the reason why I'm showing you these things is to talk about how access to specific data can ultimately lead to contextual information to help to put that data into context. Ultimately, the data are important for helping to direct people to resources that can help them lead healthier lives, affect the healthy behaviors that they want, and make healthy decisions, and make informed decisions. The other thing, however, is that there are many other things being considered by the Health IT Policy Committee. This is the committee that makes recommendations to the Department of Health and Human Services. And of all the things that they've been considering, a number of them relate to what someone could do once they have the capability of viewing and downloading that information. So when the policy committee held hearings about what patients and families want and how to meet the needs of diverse populations, they heard a number of things. One of the biggest ones was that in the future, for data to be useful, it needs to be provided to an individual at the point of care or at the place where they're making decisions. And in a lot of cases, that's going to be through some mobile device. And in order to understand how they're going to use that, we really need to better take time to understand what they're doing. Kim talked about the specific goals about accomplishing health tasks. Most consumers really are interested not so much in apps for apps' sake. They're interested in how can I take care of X? How can I better manage my health with respect to Y? And by finding specific ways to meet those specific health tasks, there's a lot more likelihood that we'll get closer to solving that paradox that Kim mentioned, the paradox of high interest and low adoption. And then finally, the issue of incorporation of patient-generated data. And again, the ability to have view and download and ultimately transfer of data opens up possibilities for information flow going bidirectionally. And so the idea that in the future that these types of technologies can help to get patient-reported data related to quality of care from the patient's perspective, as well as biometric or remote monitoring data, is really valuable as well. So with that, I'll pause, look forward to questions, and hand it over to Michelle.
Okay, thank you very much. I am going to get started here. I'm having trouble seeing the slides, so I will be advancing those. Please let me know if you are not keeping up with the slides as I'm talking about those. I will be working from a little bit blindly here, I'm afraid. So what we've been hearing about has been some really exciting things, and I'm so excited to be in healthcare right now because I love the idea of empowering patients, and that's what we're doing. We're a part of something that's so exciting because many of us are the healthcare advocates for our family members. They go to doctor's offices, they're afraid to ask questions. Oh, they're busy, I don't want to ask. Well, this is about changing that paradigm and really letting them know that they have a right to know, and this information is absolutely for them, and their questions are welcomed, and they should feel comfortable asking questions. So it's important to bridge that gap, though. We've heard a lot so far about empowering patients and all those great things they're hearing, but if we just look at meaningful use, those really don't match. The requirements of meaningful use stage 1 versus what our patients are expecting, there is a huge gap between the two, and I really loved what Kim said initially about clinician endorsement is the other half of making this successful, and patient empowerment, of course, is the first half. So our patients are hearing that these personal health records are going to help them manage their health information, improve communication with caregivers, improve the quality of health care, and improve the coordination of their health care. So that's a tall order that we've been given, and it's up to us to meet that challenge. And so finding the right tool to accomplish that is really what we're all being faced with, because initially people started coming to me saying, you know, we really want to meet meaningful use, can you help us? And then it evolved into, whoa, the hospital down the street has this, or the patient heard that they should be able to expect that. And there's, a lot of anxiety around that. Okay. Now, the other part of that, of course, is that the patients are expecting to be able to access that information anywhere that they have internet access, and to be able to share that in an emergency, which of course can only help us to care for them better. And that is so helpful, of course. Now, if you advance to the next slide, please, Patrick. The challenges that are coming about are, a lot of them are physician-based with our hospital users that we work with. And because we work with so many different cultures, different dynamics, there are some hospitals that have a patient portal at the bedside while the patient is an inpatient, and they're seeing those results a few seconds after they are complete. And then you've got other areas, cultures, dynamics where the physicians are very concerned about the patients having such quick access. They really want to see that first. And so they're using that 72 hours that are part of the meaningful use requirement. So that's been, we've seen it run the gamut, but of course as the stages progress of meaningful use, the expectation and the timeline will shorten. So patients are expecting that, but we need to validate the concerns of our clinicians, of course, and have a plan in place for how we're going to get there. So physicians are seeing patients, run out and they're researching the results of their tests. They're coming to the physician's office telling them, what their care should be. So that's been a bit of a challenge. Going to the next slide, we can also see that the security management becomes a big concern as well. So you certainly want to consider this, especially around the identification of patients, because many of our hospitals have chosen to have patients identify themselves in person. We have patients who have a significant other who has all the details you'd ask for, that social security number, that driver's license number, whatever it is you're going to use. Unless they come there in person and show their ID, there's really no way to be sure that they're the ones who are getting the authentication code and the sign-on. So some people are requiring in person, or they'll do it during that visit to the physician's office or the hospital, or via email. So that's up to you how you how you plan to do that. But having that plan in place early and being able to answer the patient's questions is of course so important. And the next slide of our security management challenges, you also want to consider guardianship. Those patients who are minors, the parents or guardian want to be able to see that information, but that patient, that minor patient, as soon as they hit the age of independence for their state, you need to expire that. You also need to consider that some state laws have clinics, for instance, birth control, where a minor child is able to go there independently, confidentially, and even the guardian is not supposed to see that detail. These are some big challenges around security. And custodian relationships are a little bit different in that they don't expire. So really considering those details as you're setting out your plan and having that in place is a great start, making sure you're considering these things. And of course, I've seen some questions coming through about sharing information, sending it, downloading it, printing it. Again, security is a big deal here. We want to make sure it's encrypted. We want to make sure if it's printed, you know who's printed it. If that patient prints it and leaves it in a restaurant, someone finds it, and you don't have on there that this was printed by the patient, they might think a hospital personnel had printed it and was careless with it. Again, a big consideration there as you are trying to manage security. Going to the next slide, we have had some issues with hospitals where their timelines were extended because they had challenges around the marketing and community education. As each of the previous presenters had mentioned, educating the consumers is so important, letting them know what's out there, letting them know how to do it and what to expect. So having a plan in place, getting it in a monthly newsletter, adult education, and newspapers, things like that, really letting them know that you've got this coming, it's a service you're providing. We're seeing a lot of competition among healthcare providers, the institutions, whether it's physician office groups or hospitals, nursing homes, rehab facilities, just really wanting, patients are expecting this, and they might choose one over the other based on the accessibility of information. So the next challenge is around the support of your patients. If all of your clinicians are not on board and don't understand the plan, they are the representative of your facility. When that patient goes for physical therapy or goes to have an x-ray and they say, oh, I want to get on that, and your representative, your staff member doesn't know about it or doesn't know where to send them, how to help them, then right there you've lost someone. So really having the internal communication and education occur as part of that implementation plan is an important part as well. We've seen some, just some not horrible outcomes, but certainly they could have been better if everyone on the team understood their role and how to help patients. So where to send patients. And then finally, the last challenge is around measuring your success and really making sure that you have a way, and in the beginning you set out a plan for how do we measure user satisfaction and user usage, making sure that there is a way to accomplish that and some ways to measure that detail, and so that as you use this for a few months, those champions, those people who are helping you, are able to accomplish that. And then finally, just pulling all of this together, just to summarize, to ensure the success is really getting those champions on board, letting your physicians know you validate their concerns. Different communities are going to have different levels of anxiety around that information sharing, making sure you educate your consumers, and planning for patient support. Where do they go? Who do I send them to when they call with an issue? I can't get activated. I can't get on here. What do I do? How do I find it? And so have a plan for that. Make sure somebody knows who's in charge of helping them. Have a plan for secure access and putting your patients at ease to know that. And then, of course, the data gathering so that you can prove, you can show, yes, indeed, Kim shared some wonderful statistics. That's what's going to get those champions, get your community excited about using that and really seeing the benefit. So I appreciate your time, and Patrick, I'm going to turn it over to you for some questions and answers. Thank you.
Thank you, Kim, James, Joshua, and Michelle for that presentation. Just a reminder, a full archive of this presentation will be available at a later date, along with a PDF copy of the slides. There will also be an exit survey appearing shortly. Once the exit survey is opened, you'll have 5 minutes to complete it. Your feedback is important, and if you complete it, you'll be entered for a chance to win a Kindle Fire. We'll now move into the Q&A portion of the presentation. Please be sure that you've submitted all of your questions in the Q&A panel. Questions submitted in the chat area may be missed. So with that, we do have some questions that have already come in. We're going to start with this first question. I believe this came in during Kim's portion of the presentation. The question is, who are the 27% who are not VA members?
Okay, well, that's a great question. We track those statistics, and we know that in addition to veterans registering for an account, it may be that a family member or it could be a VA employee. So we track that just to know who's using the portal, and I think a significant number of those non-veterans are, veteran family members or caregivers.
Okay, great. Thank you so much. Our next question is, are there plans to recommend any XML-based data format like CCR or CCD to serve as the basis for data transport?
Kim, I can take that one as well. And if you recall the slide where we tried to kind of share the vision for where we're headed, I think we have started off with the most simplest mechanism to get data into consumers' hands while recognizing the benefits of tagging approach that would enable transport and interoperability of the data. So we fully intend to move in that direction. As you know, it's been somewhat of a moving train, so it's really a matter of doing so in a way that continues to make this most broadly available for the population that we're serving. So we intend to continue on that pathway of evolution and to also continue to do so in a way that maximizes the benefits rather than focusing on a single proprietary standard. I think we'll see a lot of effort on this one in the weeks and months ahead. And I agree that will be beneficial to kind of systematize the transport mechanism as well. Thanks.
Great. Our next question is this VA Blue Button available to veterans survivors?
Well, this is Kim, and the intention of the My Healthy Vet portal, where the Blue Button resides, is for veterans to register for an account, to accomplish a one-time process of in-person authentication, which matches their electronic identity within the portal to the Master Patient Index, and then to be able to utilize that data. We recognize that for some veterans, accomplishing that IPA process is challenging. So policy changes then enabled power of attorney, for example, to be able to complete that as a proxy. In terms of others accessing specific veteran data, the principle behind My Healthy Vet and the Blue Button is really that the veteran owns that data. And so all of our infrastructure and policy is built on the idea that veterans would initially authorize access for that data to be extracted from the VA electronic health record into their own personal, secure web space, at which time they really own the data, and only the veteran can then authorize access to that data. So I hope I've addressed that question. It's really built on a model where veterans own and authorize and manage that authorization for others to access their personal data.
Okay, great. Thank you, Kim. Next question. Was there any negative feedback about Blue Button from veterans?
So this is Kim, and I think I mentioned early use of the blue button. I think one of the things that came back as feedback that was negative was that veterans often have been with our system for many years, and our initial offering was kind of like, click the button and get everything. So we quickly responded to that feedback, and by allowing veterans to customize their download, really gave them a lot more power, and I think it really increased the usefulness of the blue button. The veterans could then kind of customize their download depending upon how frequently they use it or what the intended purpose of use is, and we got a great response to what was initially a negative, and I think we turned that into a positive by responding to that. The other negative criticism I think that we've had is that it's really a reflection that consumers are hungry for access to their data. So as much as we began purposely by developing a product that could easily create access to the data that was currently available, we did at that time and continue to get really calls for increasing data. I think it's clear that veterans want access to all of their data, and so we are on an incremental pathway to continuing to add new data classes available to My Healthy Vet and to the Blue Button. And I think being able to, one of the things that I think we learned from that experience is it's really about expectation management. So being clear about what can and can't be done. But the other lesson I think we learned was, start small, but start. And we've been happy to add additional data classes, VA appointments, VA allergies, VA chemistry, hematology, lab results, in response to that early feedback about wanting to have as much data as possible from the electronic health record.
Excellent, thank you. Our next question is, can someone address the issue of inoperability? If data is self-entered, there aren't any supported data standards, therefore making inoperability difficult.
Well, this is Kim. I could just offer a comment, and then my colleagues can certainly expand on that. I think what we noticed even as we a couple of years ago began to look at how best to do this, was that there was a gap. That there's a gap in some of those standards, being able to have metadata and characterize this patient self-reported data. So I think just having been able to identify that a gap has been really important. And I think our colleagues at VA have done some pretty amazing work in terms of developing some strategies to try to address the gap, that language simply didn't extend to patient self-reported data. And I think that kind of speaks to, the paradigm change where we increasingly recognize patient self-reported data as a really rich source of data that should be, part of the clinical encounter. And so I think we'll see some progress in that regard. In the interim, what we've tried to do with the Blue Button is take an approach that enables it to be parsable, but not trying to get bogged down in the evolution of interoperability standards. But I think we'll see some great progress in that area in the coming year.
Patrick, Jim here. If I could add to what Kim has said and emphasize one of the key points that she made, and that is that by starting with the text file, the ASCII file, the as simple as it gets file, the data stream that can be read on any computer without special software, what we did, and I don't know how deliberate it was, but what we've done is we've established a standardless standard, if you will, that allows very smart people out there to build parsers, to be able to accept the data stream, recognize characters or phrases or words in that data stream, I mean, the word name means what follows is probably somebody's name. The word penicillin usually means something along the lines of penicillin. Anyhow, build data recognition parsers that can take the data and import it into other applications. And what we're seeing in the industry is that folks have actually, or not only actually, but they're in the process of doing that. They're coming up with some pretty innovative kinds of apps that take the blue button data streams and move those data into other applications.
Okay, great. Thank you so much. Got another question here. For the blue button data format, did you consider to use the Community of Care document, CCD, format? Do you foresee offering that as an option for the future?
Jim, here, I'll take. Go ahead, Kim. You probably have that one.
No, I certainly welcome your response. I just was going to say that having lived through the accelerated pace of evolution, as Jim said, we really focused on the simple text format. I think there are, there's still differences of opinion about the most appropriate best standard. So, we continue to work closely with our colleagues at our sister agencies and, be able to kind of adopt standards, but in a way that really won't slow down progress, but will continue to work towards interoperability, recognizing how important that's going to be for being able to securely transport that data in a standardized way. Jim?
Yeah, Kim, perfect, beautiful answer. Beautiful answer. The only thing I'd add to it is that when we developed Blue Button, we didn't see it as an either-or situation. We didn't see it as CCA, CCD, or nothing, nor did we see it as an ASCII or nothing approach. We saw that enriching the ways in which people can get access to their own data would empower them, and that's the direction we took.
Okay, great, thank you. And it looks like we are just about out of time here, so out of respect for everybody's schedules, I think that will be the last question that we'll take. We do have copies of all the questions that have been asked, and we'll try to follow up with all of you. We do have a great amount of questions that do come in, so thank you for all of your questions. If you'd like to learn more, please visit Iatric Systems at booth 7905 at HIMSS, or join Michelle for a complimentary webcast on January 31st or February 8th for a first-hand look at Iatric Systems Patient Portal Patient Access. To register, go to iatric.com, or you have the option to stay on the exit survey if you'd like to attend. Again, I'd like to thank our speakers for today's presentation, and on behalf of HIMSS and Iatric Systems, I'd like to thank all of our participants for making this web conference a huge success. Thanks for